on several in North Carolina, on several Facebook groups. There was a clinician who came out saying shortly after President Trump was elected in November that she would not accept any maggots in her practice.
Like as clients?
As clients. Yeah. Yeah. And she spelt it Maggotts, I believe.
Like a maggot.
Like a maggot. Right.
Yeah.
Right. Referring to the MAGA movement. Right.
Yeah.
So that is really, I mean, that was just unbelievable. I know that a lot of people in the community complained, and I think I haven't seen this individual back on the sites, but that is just coming right out and saying who you are. You know, similar to a physician who takes an oath, I really believe that we take an oath to, again, serve all people of all communities. But again, I won't be able to serve you if I don't have the expertise to serve you, if it's not my area of expertise, right? A lot of areas that aren't my expertise. I'm not an expert in autism. I'm not an expert in ADHD. I'm an expert in, you know, medical issues and grief, in anxiety and depression. You know, I may need to get some more training on that if I want to serve those other populations.
I just have so little sympathy for that position of like, I'm not going to treat anybody whose politics are different than mine. I've had clients over the years whose politics ranged from communist to libertarian and everything in between. And I've had a lot of people who were difficult for me to work with because of things about them. I've worked with rapists, people who were into child pornography, things that really stirred up some big feelings within me. And I have to say, okay, I'm going to put this over on the side. My duty right now is to help you get better. And on some sense, I think in some of those cases, there's like an added motivation, because if somebody's causing a lot of harm in their life, I think that's even more reason for me to help them, if that makes sense.
It does. It does. And what I always say, and what I say to people who are, sort of younger in the field, and I will never stop saying this, is focus on the work, right? Focus on the clinical work. What are you treating? And if it's a really, really difficult case and you still want to stay with it, get your clinical supervision from somebody who has expertise in this particular area.